Testing, testing. All right.
Let's get another testing.
Testing, testing. There we go. No worries. We can adjust the mics and... For once, it's not me. That's kind of a... I don't know what to think now. Yeah, come on over here. You're part of the speakers. So
Yes.
yeah, join us right there. There you go. Perfect.
Now you're
Deep breath. You're good. You're good. Testing one more time. All right. Well, thank you for everybody being here today. My name is Craig Reed. I'm the project manager for the Binge and Underage Drinking Initiative. I'm here today with my colleagues, Jim Everstein from the Marijuana Prevention Initiative and Marla Kincaid from the Meth Strike Force and Prescription Drug Abuse Task Force. We and our allies are here today to launch a new county-wide effort. Our goal is bold and simple: to eliminate fatalities and injuries on our roads related to driving under the influence of drugs and alcohol. A vision of 0 DUIs in San Diego County. To provide everyone some context on the importance of this work, I'd like to welcome District Attorney Summer Steppen to the podium now to say a few words.
Thank you, Craig, and thank you for everything that you're doing in this regard. This is a bold vision today, but it can be a reality if we all come together as a community. I'm Summer Steffen, San Diego County's District Attorney, and while we have a dedicated team and a homicide DUI team that works around the clock, helps respond to fatalities, prosecute those cases in court, obtain justice for the families, we can never return a life back to our community. And we can never eliminate the lifelong suffering that families feel when they lose a loved one in a manner that is so preventable. Every day we hear about a fatality, a crash, a DUI. It is a reality, but it doesn't have to be. What I'm going to focus on are the numbers. And the reason that I wanted to be here today is because this problem is not going away and it is getting worse. We've seen a dramatic increase since 2019 in the number of DUI and drug-related fatalities. The leap was something that really took us by surprise. There are many theories as to why this happened. Of course, it fits within the COVID time period that we had in 2020 and 2021, but it seems to continue to trend upwards. In 2019, we had 15 DUI-related deaths. And when I say DUI-related deaths, that includes a portion that is a combination of drugs with DUI or just drugs, intoxication based on drugs. That 15 number was already something that so many people lost sleep, had pain in their heart over, but that number in 1 year, in 2020, went to 30 DUI-related fatalities, with actually 33 that lost their life in 30 incidents. And then in 2021, we were looking forward to this trend stopping, but that number of 19 in 2019 to 30 in 2020 losing their lives to now in 2021, 38 DUI and drug-related fatalities. This is a trend we must stop, and we cannot stop it only by prosecution. We have to stop it by prevention. And this is why the effort by Craig Reed, by Dr. Luke Bergman, by everyone who is here is going to make a difference. Our hope is that everyone will begin talking about it today, before the weekend, before people go out at night to bars and different places, and begin their social activities, to begin talking about this number and committing that they don't want to be in any way responsible for someone to lose their life. Another thing that we've been tracking is this combination of drugs with alcohol. And in 2021, we had 24 of the 38 incidents of DUI fatalities were alcohol only, but 14 were a combination of drugs and alcohol or just drugs. Cannabis and prescription drugs being a big part of that. And it's important to also stop and realize that while cannabis may be legal for certain ages, that in combination with alcohol, we are seeing an impact on our streets. This combination of an increase in the drug use in combination with alcohol, prescription drug, we've also seen in 2019 and in 2020. So this is about bringing awareness to all of our partners, making everybody responsible, from the restaurant owners, the bar owners, to the convenience stores that sell alcohol, to always be mindful, to friends when they're hosting events, to be mindful, to be responsible, to be our brother and our sister's keeper so that we can save lives. It is my pleasure to invite Dr. Luke Bergman to the podium. He is leading many of the behavioral health and also county services addressing this area.
Thank you so much, District Attorney Summer Stephan. Good morning. Thank you all for being here to discuss this really important issue. My name again is Luke Bergman. I'm the director of the County of San Diego's Behavioral Health Services Department. As District Attorney Stephan said, we're here today to take a stand on an important topic: traffic fatalities and injuries caused by intoxicated driving. I am also pleased to support the launch of Vision Zero to eliminate all DUI-related traffic injuries and fatalities. The 14% increase of DUI injuries, which is data separate and apart from fatalities, in San Diego County over the last 5 years is alarming. A 14% increase. In fact, about 7 San Diegans are injured each day in an alcohol-involved motor vehicle crash. Really striking numbers. And this is something we have been talking about for a really long time. When I was 14, my best friend at the time lost his older sister when she was in a crash with someone who was driving while intoxicated. And this forever and totally changed the trajectory of his life. For many years, I lost him as a friend, and his family has never really recovered. And that's the thing. And you heard Summer Stephan speaking to this. It's not just the number of fatalities. It's how these numbers are multiplied in their tragic impacts. We're addressing this trend, injuries and fatalities, head-on through multi-layered prevention efforts, including advocacy of environmental changes and education around safe consumption. We need to continue to work towards educating the public about safe consumption, with particular attention to the dangers of consumption of multiple substances simultaneously. Additionally, servers, retailers, promoters, and marketers of commercial intoxicants need to be aware of their responsibilities surrounding safe consumption. California has enacted a law to take effect later this year that will require alcohol servers and sellers to be trained about the effects of alcohol, signs of over-serving, and how to refuse service. Safeguards like these are important to support residents in living safer, healthier lives in San Diego. Now it's my pleasure to invite Samantha Taylor-Torres to the podium to discuss how we can work with youth to prevent intoxicated driving and promote public safety. Thank you.
Good morning, everyone. My name is Samantha Torres-Taylor, and I'm here today as representative of the IPS Young Advocates Program. I'm grateful to our other speakers for their attendance today, and I thank you all for showing your support for this important campaign. San Diego contains some of the finest institutions for academics in the state of California, and tens of thousands of students enrolled in university across the county. As these students mature into the adults they will be for the rest of their lives, they reach a crucial point of responsibility, the ability to legally purchase adult products such as cannabis and alcohol. Unfortunately, a culture of excess and binge consumption of these products can lead many young people to make life-altering decisions, such as driving under the influence. This decision is made even more dangerous when individuals mix substances engaging in polydrug substance use that can severely impede decision-making ability and reaction time. As a result, San Diego drivers and their communities are put at enormous risk, with alcohol and drugs endangering countless lives. With this understanding, the message is clear, that we owe it to our community, friends, family, and importantly ourselves to create a culture where we avoid intoxicated drinking every time, or driving every time. However, a healthy, positive community culture does not develop overnight. It requires an environment that supports safety rather than promoting potentially dangerous behavior. As a college student myself and young advocate, I hope to see such an environment and cultural change happen amongst my peer group and the spaces we inhabit, thanks in part to launching of this Vision Zero DUIs initiative. The reality is that for college students in San Diego, alcohol is often just as accessible as a can of soda or a bottle of Gatorade. More so, as cannabis products become more available and more potent, students are often enticed into hazardous intoxication regularly. Cannabis candies, snacks, and other edible intoxicants are sold across the county, and high-potency smokables are the norm in many dispensaries. Coupled with increasing rates of youth prescription drug abuse, college students in San Diego are often surrounded by a culture of intoxication. I believe that this is a disservice to our youth, our students, and our culture as San Diegans. Instead, residents of San Diego who want to see a safe, healthy nightlife need to work towards behaviors and environments that support safe habits and keep intoxicated driving off of our roads. And now I'll hand it back to Craig.
Thank you, Samantha, and thank you, Dr. Bergman and Summer Steffen, for being here today. As mentioned earlier, this launch is just the first step of this new initiative. For example, we plan to be releasing a toolkit later this year that will facilitate discussions and prevention efforts around these topics and help our residents understand the impact of DUI fatalities and injuries are having on their neighborhoods. Also this year, we'll be working side by side with our allies to work on upstream prevention efforts designed to stop DUIs before they happen, rather than relying on law enforcement to catch a DUI driver after they're already behind the wheel. Additionally, tomorrow is National Prescription Take-Back Day. Our allies would like us, for everyone here, to encourage San Diego residents to consider forfeiting unneeded and expired medications to authorized drop boxes around the county. The fewer pills in circulation, the less likely they are to be misused. This concludes our media event. Our speakers, as well as our supporters, are attending today. We'll be happy to answer any questions you may have at this time. Thank you.